Hello, and welcome to this webinar on physician-assisted suicide. Glad you could all join. Hopefully we'll get a few more joining soon. Physician-assisted suicide, which I call the abandonment of Hippocratic medicine. My name is Mark Rollo. I'm a recently retired family physician, having practiced more than 35 years of womb-to-tomb medicine. My youngest patients were in utero, and my oldest patients were over 100. And during that 35 years, I saw a very gradual erosion of Hippocratic medicine, and it's been accelerating in recent years. And we'll be going over that. But before we get to that, I wanted to dedicate this webinar to my good friend, the late William Lawton, Dr. William Lawton, who was a longtime nephrologist. He practiced in Iowa, and when he retired, he came to Massachusetts to be close to his family. And he didn't head to the rocking chair. He, in addition to giving missions in Africa, he was fighting the fight against physician-assisted suicide in Massachusetts. He gave many talks, he testified, and when he was dying from pancreatic cancer, he gave his last testimony and died just within months after that. So he was really inspiring to me, and so I am dedicating this to him, and I'm using many of the slides that he used when he gave his presentations. I'm also grateful to James Capuzzi, who's helping me out, and I would like you to go to the chat box while I'm giving this presentation. And if you have any comments or questions, just go ahead and put them in there, and James will be keeping track of that. And at the end of this session, he will go over those questions. And at that time, you'll also have access to a handout, which you can use to kind of spread the word on trying to defeat physician-assisted suicide. So this is not a new issue. Hippocrates' practice in a death culture, much like our own, is becoming. In ancient Greece and Rome, it was common for physicians to kill their patients if they were not able to heal them. And it was also common to provide abortions. And Hippocrates wanted to change all that. So he and his followers got together. They decided to sign on to an oath. It became the Hippocratic Oath. And he forswore killing. And his Hippocratic Oath was very, very specific. Unlike these modern oaths, which are very watered down and little more than a bunch of platitudes. But the original Hippocratic Oath was very, very specific. And one of the specific things was that it said, I will neither give a deadly drug to anybody if asked for it, nor will I make a suggestion to this effect. Similarly, I will not give to a woman an abortive remedy. Now, the two together were placed together in the Hippocratic Oath. And I personally believe that when abortion became legal, that really started the descent of the Hippocratic Oath, the toppling of the Hippocratic Oath. And physician-assisted suicide followed thereafter. But now, having said that, I think it's very important to keep the two issues separate. And whenever we're talking to people about physician-assisted suicide, we need to stick to that. We also need to stick to secular arguments. There are plenty of religious arguments, but the secular arguments work better with the greatest number of people. So that's what we should be doing. But Hippocrates understood what we as a culture increasingly do not understand, that a physician cannot be both a healer and a killer and maintain the trust of his patient. Now, many people are somewhat pessimistic about assisted suicide making its way across the country. I'm not one of them. I think it's about a 50-50 possibility that it could go either way. And this map kind of explains why. Um, this doesn't all project well, but you can see the red states. There are 9 states, and now they're just within the last couple of weeks, New Mexico fell, and now they have legalized assisted suicide. So there's 10 states, including the District of Columbia, and actually 11 states if you count Montana, which is a special case, and they have legalized assisted suicide on the basis of a court case. So almost 80% of the country still does not have assisted suicide. And if you look at that, the green states, those are states that passed laws after the first state fell, which was Oregon in 1997. Several states saw the handwriting on the wall, and so they passed laws banning assisted suicide. And there are 28, now 27 states, which already had laws on the books, and they're still on the books, including in Massachusetts, where assisted suicide is illegal, and we need to try to keep it that way. So what is physician-assisted suicide? Some like to use the term doctor-prescribed suicide, since it is a more active description of what actually happens, that a doctor writes a prescription for a lethal amount of drug and gives it to the patient. So physician-assisted suicide occurs when a physician helps a person take his or her own life by writing a prescription for a lethal medication. And I don't even like to use the word medication. It's not a medication. It's a lethal dose of a drug, which allows the person to commit suicide. As opposed to euthanasia, which is more active, this occurs when another person does an action with the intention of ending the life of a suffering patient. I like the definition of this man. If you know who that is, just put it in the chat box. I see who's the first who can remember this person's name. He said, "I have always defined euthanasia as death by someone's choice, someone who considers the life in question no longer worth living." This man served as a Surgeon General under in the Reagan administration. He was a pediatric surgeon. This is C. Everett Koop. So considering somebody else's life not worth living is very dangerous. And physician-assisted suicide is dangerous for many reasons. And I would like to go through many of these reasons. First of all, doctors make mistakes. I'd like to see who recognizes this individual. You can write that down in the chat box. This man was diagnosed with ALS, Lou Gehrig's disease, at the age of 21. At that time, he was only given 3 years to live. He lived 55 years and died just recently at the age of 76. So his doctors made a huge mistake in prognosis. This is Stephen Hawking, the famous astrophysicist. And where would we be if we missed out on 55 years of his genius? If assisted suicide were legal at the age of 21 when this diagnosis was made, he might have made the decision to check out. A huge mistake in prognosis. When I attended a hearing on Beacon Hill a few years back, there was a man who was testifying who said that he too was diagnosed with ALS, but his doctors were wrong, and they only gave him a short time to live. And he was still alive a couple of decades later because they had made a mistake in diagnosis. So doctors make a mistake, both in terms of diagnosis and prognosis. And when these mistakes are made, if the person chooses suicide, those mistakes are buried. Another danger is that assisted suicide is a recipe for elder abuse. Who knows Kate Cheney? Tell me if you know what state she was from. She was an elderly woman, and It reminded me of the many elderly patients that I had. And I would hear my patients say the things that are on your screen often. They would say to me, "Doc, I feel like giving up. I'm tired of living. Doc, don't get old. I don't want to be a burden." Now, depending on the mindset of the physician and the legal environment, statements like this can be taken down two very different pathways, either one of hope and encouragement or one of death and despair. This is Kate Cheney. Kate Cheney was one of the first victims in Oregon when it became legal in 1997. Her daughter, whose name was Erica, she took her mother doctor shopping, looking for assisted suicide. She had advanced cancer, and she also was mildly demented. So they went to Kate's primary care doctor, who refused to agree with assisted suicide, saying that she didn't really understand what that was all about. Undeterred, the daughter, Erica, took her mother to see a psychiatrist to see if she, in fact, was able to make that judgment for herself. And the psychiatrist agreed that she was not able to make that judgment. Still undeterred, Erica took her mother to a so-called ethicist at Kate's insurance company, an HMO, health maintenance organization. And not surprisingly, the individual who worked for the HMO, who would gain financially with an early death, agreed that she was able to make that decision. And within a couple of weeks, Kate Cheney was dead from an overdose of Seconal. So this could be repeated in Massachusetts, and it is estimated that about 10% of elders in Massachusetts are already subject to some form of abuse. Another danger is that assisted suicide puts a price tag on life. I just mentioned one. Erica, I don't know if she was one of the witnesses, but the laws are written in such a way that 2 witnesses are required for assisted suicide to go forward. And one of the witnesses can be an heir. So if a witness can financially gain, that's a huge conflict of interest. Another way assisted suicide puts a price tag on life is once assisted suicide becomes legal in a state, it also becomes a medical procedure, and a very inexpensive medical procedure. And profit-minded insurance companies and deficit-ridden governments will be tempted to steer people toward the cheap solution of suicide. This is already being done to a degree. Prior authorization. How many of you have been prescribed an expensive medication by your doctor and you're told that, no, we can't really cover this now. It has to go through a prior authorization process? Or how many of you have had an expensive test ordered, like an MRI, and get the same response? No, this requires prior authorization because maybe less expensive procedures could be done first. Now, sometimes this is legitimate, but it's often a way of putting things off and rationing. And sometimes you can do it long enough where it's too late. Or sometimes it will be outright refused. And again, if assisted suicide laws are passed, assisted suicide becomes a medical procedure. And insurance companies and governments will always prefer the cheaper procedure. Another danger, laws that advantage the white, wealthy, and well-insured should not be made at the expense of the poor, people of color, the dispossessed, and the disabled. And studies show over and over again that it is the white, wealthy, and well-insured who want assisted suicide because they get another choice. They have the money, they have the means, they have the insurance to cover treatment if they want it. And if they don't want it, they want to be able to have their physician kill them. On the other hand, the poor, the people who don't have the means, people who are already discriminated against, the disabled, they are the ones who will have a choice taken away. If they're not able to afford the expensive treatment, they are more likely to be steered towards suicide. Here's a good example of that. In 2012, many of you will remember, there was a ballot question. It was question number 2 in 2012 in Massachusetts, and it asked if we should allow physician-assisted suicide. We narrowly won that, only 51 to 49%. The same numbers in Oregon, but flipped. So Oregon approved assisted suicide by 2 percentage points. We defeated it by 2 percentage points. And it's interesting to see, look at the state, and see those who voted no tended to be in less well-to-do parts of the state. So central Massachusetts, southern Massachusetts near Fall River, New Bedford, places that are not as well off, up in the northern sector, Lowell, Lawrence, places like that, they voted against assisted suicide. Whereas the well-to-do areas, the suburbs of Boston, as you can see, the North Shore, much of the Cape and the islands, wanted it. So it is the affluent. And if we're talking to the Massachusetts legislatures and we want so-called social justice, and we want equal treatment for all incomes and all skin color, then we need to just demonstrate that it's the white, wealthy, and well-informed and well-insured who are going to benefit at the expense of the poor and the disabled and minorities. If you needed any proof, and it's not a one-to-one correspondence, but here's the state as it relates to income. And as you can see, it's the same sorts of, same kind of a map, the greater Boston area, the Boston suburbs, the North Shore, the Cape and the Islands, the well-to-do areas, the same areas who voted for assisted suicide. Now let's get into some specifics just to show that this is true. Barbara Wagner was one of the first victims in Oregon. She was a 64-year-old whose lung cancer had been in remission, and she learned that the disease had returned and would likely kill her. Her last hope was a very expensive drug that her doctor prescribed for her. The Oregon Health Insurance Plan, basically Medicaid of Oregon, refused to pay, but agreed to cover drugs for physician-assisted suicide, about $50. And she actually received a letter from Medicaid of Oregon saying that they would pay approximately $50 for her assisted suicide pills. So again, insurance companies and government see dying as a cost-saving measure, steering those with limited finances toward assisted death. Another example, also in Oregon, 53-year-old man with metastatic prostate cancer. He too received a letter saying that his cancer was too advanced to warrant expensive treatment, but the state said they were willing to pay for his assisted suicide. Another example, Stephanie Packer. She lived in California, and California passed its assisted suicide law in 2016. She was a 33-year-old at the time, wife and mother of 4 with scleroderma. Scleroderma is an autoimmune disease which slowly scars and destroys different organs of the body. In her case, primarily the lung, and you could probably see in the picture that she's wearing some oxygen tubing there. At age 29, she was told she had 3 years to live. Her physician prescribed a different chemotherapy drug, and when assisted suicide became legal, her insurance company refused to pay, but was told that the drugs to put her to death were covered for a co-payment of $1.20. Such a deal. Now, Stephanie Packer, she testified on Beacon Hill in 2019, and her testimony is a matter of public record, and she testified to this fact. And by the way, she is still living. She ultimately did get her therapy covered. Another danger of assisted suicide is it leads to a slippery slope. Wesley J. Smith is a lawyer and author and fierce opponent to assisted suicide. And he wrote a book in 1997 when Oregon legalized assisted suicide. And it was called Forced Exit, the slippery slope from assisted suicide to legalized murder. And he, at the time, since it was just becoming legal in the United States, was referring to the Netherlands primarily, where it had been legal for a couple of decades. And a pull quote from his book is this: in only 23 years, the Dutch doctors have gone from being permitted to kill the terminally ill who ask for it, to killing the chronically ill who ask for it, to killing newborn babies in their cribs because they have birth defects, even though by definition they cannot ask for it. Dutch doctors also engage in involuntary euthanasia without significant legal consequence, even though such activity is officially prohibited. Writes to Wesley J. Smith in Forced Exit, the slippery slope from assisted suicide to legalized murder. So the slippery slope is real. It starts with the extremely ill, moves on to the disabled, moderately ill, moderately disabled, slightly ill, and basically it ends up in death on demand. There are several places now. I was reading about a 100-year-old man who was simply tired of living. He checked into a Swiss assisted suicide clinic and was killed just because he was tired of living. Also, the depressed, which is really unconscionable, the depressed are eligible for assisted suicide. It's considered a patient right. You know, why can some people have it and other people can't? So in the Netherlands, in Belgium, and even to our cultural cousins to the north in Canada, they have legalized assisted suicide for psychiatric patients. So the slippery slope is not a myth. It's not a theory. It is very real. Another danger: the right to die will become the duty to die. Many of you may remember Brittany Maynard on the cover of People magazine in 2014. She was a 29-year-old California woman who, at the time, it was still illegal in California to have assisted suicide. So she went to Oregon. She had a grade 4 glioblastoma, brain tumor, and she decided to go to Oregon so she could take advantage of the assisted suicide law. And she took her own life on November 1st, 2014. So many of you may have heard of Brittany Maynard, since it was sensationalized. What you probably didn't hear about was Maggie Karner. Maggie Karner lived in Connecticut around the same time as Brittany. She also had a brain tumor. And she made the statement, "Brittany's suicide puts other patients like me at risk of abuse or subtle pressure to comply with state-sanctioned suicide." Another danger is that assisted suicide removes hope for a medical breakthrough. Can you imagine if assisted suicide were legal from the time of Hippocrates? How many medical breakthroughs would not have occurred? If people always had the option to kill themselves, there would be no pressure on people to come up with cures for disease. Now, this was the case in yet another woman who had a brain tumor. And these two women on the cover of this magazine did. And the one on the left is featured here on this slide. Her name was Marianne Anselmo. She was a jazz singer, still is, I think. I think she's still living. I couldn't find any evidence that she had passed away yet. And in 2015, she was diagnosed with a brain tumor. She went to Sloan Kettering in New York City and was given an experimental drug, and she went into remission. Her cancer was gone for a long time, and I don't know what her status is now, but because she persisted in wanting to treat her medication, they came up with a way to treat her particular tumor, and at least in the short term, it worked for her, gaining her valuable time. Another man with a brain tumor, another person with a brain tumor, this was J.J. Hansen. As you can see at the bottom of the slide, he was a president of the Patient Rights Action Fund. I suggest you Google that sometime, Patient Rights Action Fund. They are very active still in fighting against assisted suicide. But JJ was given just 4 months to live, and he ended up living 4 years. In 2014, this former Marine had the same diagnosis of Brittany Maynard, stage 4 glioblastoma multiforme. He was treated with an experimental drug at Sloan Kettering also, and he was in remission at the 2-year point. And as I mentioned, he eventually lived 4 years. He does not see assisted suicide as a choice that affects only the individual making it. Its influence on others should keep it illegal. Having the option to die will dishearten severely ill patients, especially those who feel they are a burden to their families when they need to rally their courage. You can imagine what 4 months meant to not only him, but his wife and his young son. Another danger is that it'll put pressure on the medical profession, pressure on doctors to violate their conscience. And these laws stipulate, these bills and these laws in other states stipulate that if you refuse as a doctor to comply with a patient's request for assisted suicide, you need to transfer them. Well, this still makes you complicit. And it'll get to the point where over time, doctors with consciences, they will choose to go into a different profession and not have to be put in a position where they may have to violate their conscience. And a doctor is, in these bills, required to lie on the death certificate. These bills state that you cannot put as the cause of death assisted suicide. You need to write the underlying diagnosis. So this is legalized fraud. Then there's a 2-tiered approach to suicide prevention. If you're able-bodied and you can climb these stairs that you can see, you can receive help from a suicide prevention program. But if you're disabled and not useful to society, so society may think, you can go up this ramp and receive assisted suicide. And the general suicide rate will go up. Suicide is contagious. Suicide contagion is real. And a lot of people may look around in their state and say, hey, this person with metastatic cancer, he has a bad problem. But I have a bad problem too. I have severe depression, I'm financially broke, or whatever the case may be. And they may rationalize, I have a bad problem, so I should be able to kill myself too. And as a matter of fact, if you look to Oregon, again, there was a study that was done from 1999 to 2010, and this showed that men and women ages 35 to 64 during that decade had an increased incidence of general suicide, not just assisted suicide, but a general increase of 28% nationally. But in Oregon, it was almost double that. And this has been shown to be true in other states that have legalized assisted suicide. So the general suicide rate has and will increase. So assisted suicide is not safe. Another danger is that physician-assisted suicide is not about giving patients the right to die, right to commit suicide. People can do this and do this all the time, unfortunately. These laws are really about giving doctors the right to kill. And basically, it outsources killing, and it outsources it to my profession. It corrupts the medical profession. Now, the main group behind physician-assisted suicide is Compassion and Choices. Now, they were previously called the Hemlock Society, and they realized that naming your organization after a poison was not good PR, so they changed their name to Compassion and Choices. But it is not compassionate to kill a person, to end a person's suffering by killing the suffering patient. True compassion, the word means to suffer with. And choices are not given to everybody. Choices are only given, again, to the white, wealthy, well-informed. And when you get propaganda from Compassion and Choices, they'll always say, well, we want people to have a peaceful death. We want them to avoid unbearable pain. But when you look at surveys, and I'll show you one in a minute, it's shown that this is only number 6 on their list of concerns, and we have the best pain management in history. The other argument that's often given is autonomy. My choice, my right. Well, patients already have the right to refuse medical treatment, and they may take their own lives, sadly. Again, the laws to legalize physician-assisted suicide are mainly for white, well-insured, well-to-do, well-educated patients. I've seen these signs held up many times, and when I go to testify, I'll see people wearing these badges that say, my life, my death, my choice. So when I see this, well, if you want to be so independent, why are you coming to me to kill yourself? I'm tempted to say that. I haven't said that. Okay, so why do people request so-called aid in dying, which is another euphemism, medical aid in dying, death with dignity? These are all euphemisms just to cover up what's really happening. A doctor killing his patient. So here's the reasons. Number one, less people think about killing themselves because they're less able to engage in activities making life enjoyable. Well, this should not be a reason for suicide. This should be a challenge to all of us to help these individuals make their life more enjoyable in some way. Losing autonomy is number 2. Well, we should help them with their lack of autonomy, personally helping them, having personal attendance, coming up with devices that make people more independent. Loss of dignity. What is dignity? Who has the right to say what makes life dignified? Why is some person's life dignified? Because they have more ability in some way. Why does that make a person more dignified? Or number 4 on the list, losing control over bodily functions. A lot of people feel that that's undignified. Why is losing control over bodily functions somehow undignifying? It is undignifying to a person who considers losing control of bodily function undignified. We should be helping people care for themselves. Burden on the family? Well, by legalizing assisted suicide, we're basically agreeing with that narrative. We're saying, yeah, you are a burden. Inadequate pain control, number 6 on the list. That's not even high on the list of concerns, but we have the best palliative care in history. And we can't take away all pain, but we need to look into the fact that suffering is, in many respects, very meaningful. It evokes a caretaker response from other people. So suffering is not wasted. But we have the ability to take care of most of the physical suffering that people have. Financial implications, well, there are GoFundMe pages all over the place. Surely we as a society, as a generous society, can come up with ways to help people with financial pressures. So to summarize, assisted suicide is dangerous for patients. There's loss of trust in the doctor. There's loss of choices at the end of life. There's a financial incentive for premature death. There's coercion by government to comply with state-sanctioned suicide. There's coercion with insurance, possibly with family. There's lack of appropriate treatment for depression. Safeguards don't work. In fact, safeguards are viewed by proponents as another obstacle that just needs to be overcome at the next round of legislation. Doctors are often wrong. Doctors are given too much power. Families don't need to be informed, and it can create a lot of dissension in families. It's dangerous for society and public health. Marginalized groups are vulnerable. There's increase in the general suicide rate. And what we need is more money for palliative care and hospice. And it also removes hope for medical breakthroughs. So in Massachusetts, we have been fighting this back year after year after year. It has failed 10 times, but they keep getting a little bit closer. It also failed narrowly in 2012. I really resonate with what C. Everett Koop said when he said, "I went to medical school to learn how to save lives and alleviate suffering. I saw no tension between those points of view because I was a Hippocratic physician. There was an absolute proscription on the taking of life. If I could heal or cure, I would do it. But in doing that or failing that, I would relieve the suffering of my patient. Hippocratic medicine does not require that the act of dying ever be prolonged. If my patient has received all that I can do for him, and if healing is not possible, I can alleviate his suffering and still stay well within the bounds of do no harm." The ancient doctor of those days could cure practically nothing. And it is self-evident that he did what he could within the framework of do no harm. This is the action slide. This is what everybody listening needs to do. Identify your state senator and representative. Ask, does he or she support or oppose assisted suicide? Call or write and let them know what your concerns are. There's the phone number. There's the website. Spread the word, educate others, place articles or letters in your local newspaper. The bill this year is called an act relative to end-of-life options. It is Senate Bill 1384, that's Senate Bill 1384, and House Bill 2381. Identical bill, they just have the House and the Senate have their own bill number, but it's identical, and it needs to be defeated. And it's euphemistically again called an act relative to end-of-life options. We already have end-of-life options. We have hospice, we have palliative care, and they need to hear that from us. And you can download the handout on this webinar, and you can use the handout as talking points. So at this point, I'd be happy to entertain some questions. And James, do we have any questions?
Addressed with your last slide there, but Sandra is asking, what can those who are listening do to ensure assisted suicide does not come to Massachusetts?
Well, again, I'll go back to that last slide. Here are the things you can do. The politicians, they get nervous when they get hammered with phone calls, and you can call find out who your state senator was by either calling or going to the website malegislature.gov. Talk to them, say you want this defeated, and call them again and again, put letters to the editor in newspapers, spread the word. I am happy myself to give this talk as many times as people want to listen. And anyone can reach me at my email address, markrollo978 @gmail.com. That's MARKROLLO 978, my area code, @gmail.com. Send, if you have a group, small group, medium group, large group, if you can get some people together, just send me an email and we'll do this for your group, for any group. The more we talk about it, especially to the legislators, and by the way, this will first go to the Joint Committee on Public Health. So another thing you can do when you go to malegislature.gov is you can look up the committees, and the Joint Committee on Public Health will get this bill. And they passed it for the first time. This committee did last year. It didn't go any further. But they are likely to pass it out of committee again. We need to stop that if we can. And if we can't, we need to contact the leadership. We need to contact the Speaker of the House of Representatives, his office. We need to contact the Senate President. When it leaves the Public Health Committee, it will likely go to another committee. It may be the Ways and Means, but we need to just keep track of where it's going and to hound these legislators as much as we can.
Another question from Ron is asking about Dr. Kevorkian, saying, Dr. Jack Kevorkian spent 8 years in prison for assisting in suicides before the procedure was legalized, and he's asking when was that sentencing, or how long ago was that kind of thing something you could be in jail for?
Well, I'd have to look it up to be sure, but I think he went to jail somewhere around 15 to 20 years ago.
Yeah, it looked like late 90s, 99, I think.
Yeah, so it was right around the time that it was legalized in Oregon. So it's kind of amazing that he was sent to jail for doing what is being legalized in many states in the country at this point.
Patricia asking if you could please explain the difference between hospice and palliative care.
Yeah, that's a good question. Hospice was the old term, and hospice is a program where people actually deliver palliative care. But palliative care has expanded so that it used to be that if you refused all treatment, you were done with treatment, you've kind of reached the end of your rope, and treatment was kind of hopeless, and you had roughly 6 months to live, then a hospice team, especially trained nurses, would go to the patient and give them pain medicine if they needed it, give them help with breathing, oxygen if they needed it, and just help them care for them until their natural death. Now, palliative care can precede hospice, so that when people are actively getting treatment, they're going to be suffering then too. So these special palliative care physicians, who often specialize in anesthesia, and there tend to be like critical care medicine people, they can use different means to assuage people's suffering while they're being treated. So they're different, but there is a lot of overlap.
Organizations such as AARP on this issue, and what organizations are behind it?
Well, that's a good question, and I truthfully don't know. I'd be willing to guess that AARP is well, I hate to guess, but so I'll just punt on that. But I think that this is a very good thing to bring up. One thing that I thought of myself was well, what do these organizations that fight suicide, what is their stance? And I called the Massachusetts, I forget the name of the organization, but people who are fighting against suicide in general, and I asked what's their position on assisted suicide, and they kind of said, "Oh well, not sure. We'll get back to you." Well, they never did get back to me, but I think that would be it. It would be good to call for people. That would be another good way to put pressure on. So if somebody wants to call AARP or other organizations where you think they might have an interest in assisted suicide, put the pressure on and find out what their stance is.
Quickly looking right now, so it might be something that they're not as open about.
Yeah, it would be. It's a great question. It would be good just to ask them directly, put them on the spot.
Another question from Sheila is asking kind of more, looking a little bit farther back in the process. Is there anything that can be done to prevent assisted suicide from being promoted in medical schools? So when people are training to be doctors.
Also a great question. And, I think that people like me and others can go to medical schools, can go to like residency training programs. They have lectures on all kinds of things. And so it would probably behoove me and people like me, nurses, to go to schools and go to medical students and talk to them about it. But it is, that would be another important way to get an inroad on this issue, definitely.
Up in the chat, there's actually a organization that I'm familiar with called the Hippocratic Forum that works on there are a few doctors that run it, just out of medical school doctors, and they try to kind of work on these, ethical issues, bringing in med students from Harvard, MIT, and other Boston area medical schools, and try to kind of catch them before their decisions made.
Yeah,
so that's a good one to look at.
It's called the Hippocratic
Forum.
Forum.
Yeah, they're almost brand new, but they've been doing it kind of without a name for a couple of years now.
So people could probably Google that.
Yeah, I put it in the chat too, for people if they'd like to see it.
Yeah, great. Yeah,
I got one more question. There might be more, but the one I see now from Joseph asking, is there or should there be a penalty or some kind of punishment for violation of the Hippocratic Oath?
Well, of course, I think there should be, but unfortunately, people aren't taking the Hippocratic Oath anymore. And those that do, if you look up a modern Hippocratic Oath and you compare it to the Hippocratic Oath, translated from the original Greek, they are very, very different. And what you'll get in the modern, watered-down versions are basically a bunch of meaningless platitudes. So there really, at this point, isn't a really good Hippocratic oath to violate. So there would not be. I mean, it's basically people. The medical profession has basically dodged the issue.
One more question here. This is from David. He's asking, how did the AMA, American Medical Association, return to a more Hippocratic stance on this issue? And, are there any chances, or what are the chances that the MMS will follow suit?
Well, I'm glad you brought that up, because the AMA is still very strong against assisted suicide. And this is something that needs to be pointed out to politicians, that the AMA is strongly opposed. The American College of Physicians, the second largest group of physicians next to the AMA, they are very much opposed. So Mass Medical Society is pretty much an outlier. And this is a strategy of compassion and choices, where they go after the medical societies and try to get them to be neutral. So they were able to get some inroads into Mass Medical Society and get them to be neutral. They're not in favor of assisted suicide, but they've sort of been, cajoled and pressured to make it to be neutral on the issue, which to me is an incredible cop out. How can you be neutral on protecting your patient? But I think it's important to continue to point out to people who may know members of the Mass Medical Society and say, hey, you're really an outlier. Your parent organization, the American Medical Association, is very much opposed. I also will point out that the reason they went neutral was because they sent out a questionnaire, Mass Medical Society did, to members, and only 12% of these questionnaires were returned, and it was something on the order of a 55-45 split, with 55 being in favor of assisted suicide and 45 being opposed. So they took those really kind of pitiful statistics to decide to go neutral. So the Mass Medical Society, unfortunately, with the oldest society in the country, is kind of an outlier, as Massachusetts tends to be on other things, shall we say.
How long has that oath been watered down, or being watered down?
Well, it began to be watered down around World War II. The World Health Organization was involved when, the Western medicine has been very much based on a Judeo-Christian model, and the Hippocratic Oath basically, it begins by saying, I swear by Apollo, and it goes on with a bunch of other deities. Well, Judeo-Christian medicine doesn't swear to Apollo, but the point is that it swore to a higher power, and as time has gone by, there's less and less. We become more and more secular. And when the World Health Organization included not only Western countries but Eastern countries, it became very, much more diverse, and it was much more inclined to to swear an oath to something that's transcendent. And when you lose the transcendent, these oaths that are made are really made to no one in particular. They're made to each other. So I really think that it was right around World War II, and it was when the World Health Organization became involved, that there was the erosion of the original intent of the Hippocratic Oath to swear to a transcendent power.
Just asking if Governor Baker has a position on it.
Not that we know of. He's a good politician. He won't take a stand on anything he doesn't have to take a stand on, and I don't believe he has made any public stand on this. I think he would be somewhat inclined to not want to go for this, but who knows? And he won't commit himself unless it's passed by the legislature, and he has to make a decision.
Well, that's all the questions I have. So if there's nothing else from anybody, if you have some thoughts you're waiting to write down, feel free to write them.
Yeah. Well, I want to thank everyone for attending. Don't forget to download the handout, and I would just ask you to do as much talking to people as you can. And again, send me an email, and I would be happy to do this kind of a thing to other groups. This is kind of a make or break year, because I think, as I said, it made it out of the public health committee, and so it is one step closer to getting approved. So thanks for your attention. Thanks for your help with this, and let's keep fighting the fight. Thank you. Have a good night.